So I'm just going to perform hand hygiene before entering the patient's room. Hi there, my name is Lisa. I'm a student nurse here at Seneca College. Would you be able to state your full name for me, please? Perfect, Robert Roth, and your date of birth? Fantastic. The patient has verbalized the correct name and date of birth on the documentation. And Robert, would it be okay if I performed an abdominal wound dressing change on you today? Perfect. The patient has verbalized consent. I'm just going to adjust the bed height here, and I'm going to verbalize the bed is at the correct height. My workstation is at the correct height. Just going to perform hand hygiene here, and then Robert, I'm just going to tilt you on your side there in a comfortable position. Perfect. Are you comfortable? Fantastic. And then I'm just going to put this blue pad underneath you. If you could lift your leg. Thank you. And this blue pad will allow for any drainage, irrigation, or fluid to fall onto the blue pad opposed to in our sterile environment or onto the patient's bed. I'm going to perform hand hygiene again, and I'm going to take my sterile dressing tray out of its bag. I'm going to tape this bag to the side of my workstation, and I'm going to use it as a garbage during my procedure. So I'm just going to have it at a place that is easily accessible but not within my sterile field. I'm going to perform hand hygiene again, and then I'm going to don a pair of clean gloves. Okay, are you doing okay there, Robert? Perfect. So I'm just going to be assessing the wound dressing here. The outside of the dressing seems to have a little bit of dark, dry blood. Nothing to be too concerned about there, Robert. You might feel a bit of discomfort with the tape. I'm just going to take off the dressing. And assessing the dressing here, there is some dark red, dry blood. There seems to be a moderate amount. I do see some serosanguinous fluid and drainage there, which is normal. I don't see any signs of infection there. So I'm going to throw that in the garbage. And assessing the outside of the wound there, the edges look to be well vascularized, no signs of malodor. Robert, this might be a little uncomfortable. I'm just going to take out the ribbon gauze that is packed in there. And again, assessing a little bit of dry blood, nothing to be concerned about. So I'm going to now remove my pair of clean gloves, and I'm going to perform my hand hygiene again. Perfect. Now I'm going to open my sterile dressing tray. I'm going to open it flap away from me to maintain a sterile environment. I'm then going to grab the handle of my sterile forceps. I'm not going to touch the tweezer end, and I'm going to use these to slowly place my sterile field into the correct position that I would like it for the procedure. So what's comfortable for me, perfect, is there. I'm going to use this to adjust my tray, and I'm going to take out this white drape sheet that's inside that I could use to extend my sterile field, but I don't feel the need to currently. Inside there's some 2x2s and a couple pairs of sterile tweezers. I'm going to be placing this within my 1-inch border there, my sterile border. As I touch this with my fingers as well, I'm always ensuring I am not touching within the sterile field, only outside of that 1-inch border. Next, I'm going to start by placing in some 2x2s, and I'm just going to put them in the same tray as slightly over top. I'm only touching the outside of the package, not the woven sponges. Same thing with this 2x2 here, not touching the woven sponges, just the outside of that package. I'm going to do that with a couple of 4x4s as well, with the same sterile procedure. Perfect. And when adding in my abdominal non-woven pad here, I'm only touching the outsides. I'm going to use my sterile forceps to put this in just because the packaging is a bit tight, and I just want to ensure to not break my sterile field. Just place that in the 1-inch border and that in the garbage. Then I'm going to be using I'm going to be using some cotton tip applicators. I'm going to then use my forceps just to place these into my sterile field again, just because I don't want them to fall. So placing that in my 1-inch border, this in the garbage. I'm going to then place in a syringe and a blunt tip needle for my syringe. This is for irrigation. Then I'm going to grab from my suture kit. I'm going to use my sterile scissors and place them in my sterile field. Just place that in the 1-inch border and place this to the side. I am then going to add in some ribbon gauze. For my ribbon gauze, I'm going to put lid top down, just to ensure it's still in the sterile field of when I want to close it. So I place this to the side, grab my forceps, and I'm going to be using these scissors to help grab a piece of ribbon gauze that's about the same size as the piece that I originally pulled out. And I'm just going to place that in its own separate tray. Perfect. I'm going to place that within my 1-inch border there again, just adjust it. And these as well, I don't know if I'm going to use them again, but if I do, I'd like to make sure they're still sterile. So placing within my 1-inch border, keeping that handle that's now not sterile outside. Then additionally, I need to add my normal saline. So always checking the label of the normal saline. If it's open, I want to check to see if it's initial and dated on when it was opened and when it has to be used by. So I'm checking my expiry date. This one has not been opened. So I'm going to open it myself. I'm going to place the lid top down again for sterility. And I'm going to lip this into my garbage can. That's to ensure to clean and sanitize around the edges before placing into my sterile field. I'm going to pour some into the ribbon gauze and some in with my 2x2s. When I'm doing this, I'm always ensuring that my hand is placed on the label as I do it. Perfect. So I'm just going to cap that back up again because I'm not going to use that. And same with my ribbon gauze. And then I'm going to perform hand hygiene. And I'm going to go over here and I'm going to, never putting my back or turning away from my sterile field, I'm going to apply my sterile nitrile gloves. I'm able to touch the outside. Just going to throw that in the garbage. And again, just maintaining my 1-inch border of sterility. Perfect. For this one, I'm going to use my dominant hand. And I'm going to, use my non-dominant hand to grab the inside cuff, and I'm going to glove my dominant hand, going to tuck in my thumb and slowly maneuver my hand into the sterile glove. And I'm going to roll that down there. Perfect. Maintaining sterility. Then I'm going to use my dominant hand and cuff under. Perfect. And just to slip my hand in there, pull down, and we are now gloved with sterile gloves. I'm going to go over here and begin my irrigation. So first thing I'm going to do is grab my syringe, and I'm going to grab the blunt tip. I'm going to attach it to my needle, and then I'm going to fill it with normal saline. I'm going to irrigate the wound. What I'm going to do is do a zigzag motion from top to bottom. I'm going to watch to see, it might be a little cold there, Robert. I'm going to watch to see that the fluid is running clear. Right now it's running pink, so I'm just going to add a bit of more normal saline. Are you doing okay, Robert? Perfect. And I'm just going to irrigate a bit more to ensure it's completely clean and it's now running clear. I'm then going to dispose of this into my sharps container. And then I'm going to clean the wound. So I'm going to use not touch my transfer forceps. I'm going to use my sterile tweezers, and I'm going to grab my 2x2s that are soaked in normal saline, and I'm going to just slowly wring them out a little bit. Perfect. Then I'm going to make sure I have a good grip on it, and I'm going to clean from cleanest to dirtiest from the middle down, and I'm going to dispose. One wipe for each. I'm just going to do the same thing here, maintaining the same sort of technique maintaining the same sterile field. And I'm going to do this a few times. I just want to make sure that this wound is completely clean and good to go. Okay. Next, we're going to use our cotton tip applicator to measure the wound. So we always want to measure length times width times depth. So without touching the wound in any way, without the cotton tip applicator or my gloves, I'm going to measure the wound. I have my ruler here. It seems to be about 4 inches in length, 2 inches in width, and then for depth, again, not touching, about 1/2 inch for depth. I'm going to dispose of this now. Perfect. And then next what I'm going to do is I'm going to use my normal saline covered ribbon gauze. I'm going to use a pair of tweezers, and I'm going to just use my 2 fingers and slowly wrap it around and just drain it a little bit. I still want it to be somewhat damp, but I don't want it to be soaking wet. Perfect. And then what I'm going to do is I'm going to maintain sterility and just pack slowly without touching this on any of the wound edges at all, just taking my time, packing this in. I don't want it to be too tight, but I do want it to be a bit snug in there. Perfect. Maintaining a sterile field the whole time. Perfect. So next what we're going to do is we're going to place some 4x4 dressings on the wound. So I'm just going to use my tweezers, assessing the wound. Looks good, it's healing properly. Perfect. So the wound is covered there, and then I'm going to add that abdominal 4x4 because I did see a little extra drainage there in the beginning. So just to be safe. Perfect. Now sterility doesn't matter as much because the wound is covered. So I'm going to remove my sterile gloves. And I'm going to then perform hand hygiene. And then I'm going to get some tape here. And I'm just going to tape this abdominal wound there, Robert. Just so you're nice and comfortable. I don't want it to be too loose or too snug on you. You're doing all right. Perfect. All right, and then, perfect. What we would do next is, are you doing okay, Robert? Do you feel any pain? Perfect. Okay, then we're good to go. So what we would do next is we would clean up our sterile field. We would make sure the bed is at the correct safe height for the patient, and we would leave. Thank you.